Hi, my name is Marcy White. I am the owner of Copley Acupuncture in Salem, Massachusetts. And I just wanted to talk briefly today about something that I do in my practice called low-level laser therapy and how it pertains specifically to fertility treatments. So I've been using low-level laser in my practice for about 15 years. It's something that has existed since 1967, predominantly in Europe and Asia. Most people had not heard of it until fairly recently, and it is gaining a lot of popularity because of its ability to help with healing tissue. And so specifically what it can do is it can target cells and their mitochondria to increase ATP production, which helps a cell to function better and to help it to repair itself. One of the reasons this is so exciting about its effects on mitochondria is because your eggs as a woman have 200 times more mitochondria than any other cell in the body does. So hypothetically, if you can get the low-level laser light to reach the ovaries, then you can increase egg quality. So what this means is that if you are going to your physician and they're telling you that there's nothing that can be done, that your eggs are too old, that you aren't responding well to IVF, that there are some other options, and this is a very promising one. There has been research in Japan for the past 15 years, and there's been research in Denmark for the past 5 years that has shown great promise in this helping with egg quality and helping with better outcomes with IVF and other fertility treatments. Now, one very important fact about using the low-level laser if you want to get the desired effects that we're looking for in treatment is that it is something that takes some time. So it's recommended that this is done for at least a minimum of 3 months, sometimes up to 6. And what we do is if you're trying on your own without any assisted reproductive therapies at all, then we do 3 times a week in the first 2 weeks of your cycle, called the follicular phase, and then we do twice a week in the luteal phase. If you're doing it with IVF, we have a little bit of a different schedule, but generally you want to do this for at least 3 months to have any effect, because the follicles that you are seeing happening or appearing basically in a scan if you're doing IVF, right before you begin, those are called your antral follicles. Those antral follicles started as a primordial follicle 3 months earlier. And so in order to get the effect on that antral follicle, it has to be done for at least 3 months. So sometimes I do have some patients that come in the middle of the cycle, they don't have 3 months. We can certainly start it, and if for some reason the IVF cycle was not successful, it would put you in a better position for the next cycle. That is one way to look at it. I'm just going to give you an example of one of the lasers that I use in my practice. This is called the MedX laser, and what it is a type of laser, we call it a shower head shape, and it has LED lights and laser, so it's red and infrared mixed. Red light has a shorter wavelength than infrared, so what this does is it's able to penetrate through multiple layers of the abdominal cavity. So everybody's ovaries are in a little bit of a different location or depth. We're not always 100% sure exactly where things lie. So what this does is when it presses against the skin, it's able to spread over double the diameter of this here, which is called the aperture of the laser. So this is just one type that we'll use directly over the pelvic area. I also use these in the lumbar area to get more blood flow into the pelvic region. And then there's a treatment that's done on the neck as well, over the carotid arteries and some over a structure called the stellate ganglia, which helps get a lot more blood flow to the brain and then throughout the rest of the body. So I hope you enjoyed this video and just a little bit more information about how low-level laser can help with fertility. Thank you so much.